Welcome to Quickfire Medicine, your place for fast, high-yield content for medical students and junior doctors. Today's topic is on causes for iron deficiency anemia. Iron deficiency anemia is the most common cause of anemia overall and is a type of microcytic anemia. The three main causes of iron deficiency anemia are reduced iron intake in the diet, reduced iron absorption from the GI tract, and chronic blood loss, which is probably the most important cause. Reduced iron intake in the diet is a common cause of iron deficiency, but is relative to the population in question. The recommended daily dietary intake for iron is 8 mg for men, 18 mg for non-pregnant premenopausal women due to the iron loss that occurs with menstrual bleeding, and up to 28 mg in pregnant women. This is because of the increased demands in pregnancy, with total blood volume increasing by nearly 50% over the gestational period, some of which is from an increased red cell mass. This makes pregnancy a common cause of iron deficiency anemia because supply usually can't keep up with demands. Iron is mostly found in meats, and particularly red meat, making vegetarians much more likely to be iron deficient. Green vegetables, beans, and lentils also contain iron, but those with poor diet usually lack these foods. The second main cause is GI malabsorption, where not enough dietary iron is absorbed by the intestine into the bloodstream to be stored away or incorporated into hemoglobin. There are many causes of GI malabsorption, but the three most common causes are the three C's, which are celiac disease, Crohn's disease, and chronic pancreatitis. However, the most important cause of iron deficiency anemia to consider is chronic blood loss. This should be distinguished from acute blood loss, where even though iron is still being lost, the body's overall iron stores can compensate. Any form of chronic bleeding will eventually deplete iron stores, causing iron deficiency anemia, with a very common example in women being heavy menstrual bleeding, also known as menorrhagia. The red flag to know about in this instance is chronic GI bleeding, as this occurs in upper and lower GI malignancies like esophageal and colorectal cancer respectively, where symptoms like PR bleeding, weight loss, or change in bowel habit can be missed for a long time, but a blood test showing iron deficiency anemia can often be the first clue. This is why it's important to do an abdominal and PR examination for anyone with unexplained iron deficiency anemia, especially in older patients. The main investigation is GI endoscopy to look for the source of potential GI bleeding and in particular malignancy. In the UK, for example, anybody older than 50 with unexplained iron deficiency anemia should be referred on an urgent 2-week wait basis to colorectal surgery for a colonoscopy, usually followed by an upper GI endoscopy if the colonoscopy is normal, the so-called top and tail endoscopy. So that's all you need to know about iron deficiency anemia causes. If you enjoyed this video, don't forget to hit that like button, comment down below, and subscribe to my channel. Thanks so much for watching, and see you next time.